In cold distemperament, besides feeling coldness of the body by patient or physician based on acute or chronic incidence of cold distemperament that is usually chronic, the digestion in its 4 stages is weak. So, for example, in stage 2 of digestion, we have more production of phlegm and less production of sanguine humor. This leads to paleness of the face, paleness of the inner layers of the mouth or other surface of inner organs, paleness of sclera. You have white sclera. Also, because of more production of phlegm, the joint will be more loose. Loosening of joint is another symptom or sign of cold distemperament. Thistyness will be felt less than usual because the body have less evaporation of the water and feel no need to cooling. The pulse is usually slow. The high of pulse is low. I will explain it in section that's related to the pulse, because the heart is involved in cold distemperament. And if you take notice, sometimes cold blood will feel under the fingertip when you examine the pulse. The signs and symptoms of cold distemperament will be worse by cold agent, I mean air, cold water, or cold temperamental food. It will be worse in winter as a cold and wet temperamental season. And the patient feel better in its signs and symptoms. For example, if he or she had headache, if or she had bloating, by using warm agents, I mean warm water or warm bathing, warm air, for example, trip to warm area, or warm temperamental foods by eating them. And you can treat it by using warm temperamental medication, all correcting the 6 essential toward the production more warmness. For example, prescribing an exercise. These were common signs and symptoms of cold distemperament, but in each organ, by involving with cold distemperament, there are some other special signs. For example, if a stomach be involved with cold distemperament, sore bloating and more production of gas will be a consequence. Sometimes sore regurgitation or sore reflux. If the liver has cold distemperament, besides the more production of phlegm and less production of sanguine, patients have a color on face because of weakness of natural spirit that is yellowish, greenish, black color. It's an special color for weakness of the liver. If you practice sometimes, only by watching the face of the patient you can detect the weakness of the liver or cold distemperament of the liver. In uterus, it may be cause amenorrhea or little menstruation of a slightly red color of bleeding. The amount will be low. The pubic hair is low or there is no pubic hair when uterus get involved with cold distemperament. Reversely, in warm distemperament of uterus, we have too much noticeable growing of the hair on pubic area. If cold distemperament involve the kidney, for example, the patient have no sexual desire, plus colorless urine. We have colorless urine, of course, in cold distemperament of the liver. Patient with cold distemperament of the kidneys maybe have difficulty in urination, because kidney, especially if the patient is a man, because kidney and prostate has relationship with each other, and we can use warming of the kidneys by, for example, wearing a woolen scarf around the kidneys or waist area and warming the kidney. We can treat prostate benign hypertrophy signs and symptoms by warming the kidney. Patient with cold kidney or cold distemperament kidney have humpback. They can't erect their spinal